Hello everybody, Dr. J.B. Ketner with Memorial Healthcare Systems here today to talk about COVID vaccine side effects. It's a picture of Bonnie Henson giving me my first Moderna vaccine. There are some common side effects with this and most vaccines. Commonly you'll get some pain and warmth at the injection site, some low-grade fever or mild flu-like symptoms, and if you watched the first video about how these vaccines work, you'll know that I view this really as an immunogenic response. This is out of the slide deck from the original vaccine presentation, and you'll see over on the right-hand side of that illustration that ultimately copies of this spike protein, again, not the entire virus, but just the spike protein, get presented to your immune system. Your immune system, in response, does a lot of things, but it produces antibodies and helper T cells and a lot of other immune things are happening, and as a result of that, you can have some of those common side effects, just like you feel when you get other viral infections. So there are some very rare serious side effects, and when I say very rare, I'm talking about maybe 1 in 200,000 folks that get these vaccines can have any one of these serious side effects. Of those, the least serious is probably hives, which most people are familiar with, a blotchy, itchy, kind of migratory rash. But on that continuum, very rarely angioedema or anaphylaxis can happen, which are serious life-threatening problems. Angioedema is swelling of the lips, nasal passages, or mouth, and anaphylaxis is a systemic immune reaction, which is potentially fatal and very serious. If those happen, obviously you need to seek medical attention immediately. And if you had that with your first vaccine, which again is exceedingly rare, we'll talk about what you need to do. So that leads right into this. I got my first dose of my COVID vaccine and I had side effects. What should I do when I get my second dose? So if you got minor side effects like local pain, discomfort, or swelling, use some ice, take some Tylenol or ibuprofen, and try to use your arm if you can. For those low-grade fevers and flu-like symptoms, Tylenol or ibuprofen are helpful for that. Typically, with the low-grade fevers and body aches, that's the first day or two, and that's what I experienced when I got my vaccine. I had some warmth, soreness in the arm for 3 or 4 days, and from between the first and second day overnight, I had a little bit of low-grade fever. If you got these major side effects that I talk about, hives, angioedema, or anaphylaxis, you need to talk to your primary care physician before getting your second dose. Furthermore, if you have a history of angioedema or anaphylaxis with any other vaccine, you should probably talk to your primary care doctor before getting your first shot. So keep in mind, these Moderna and Pfizer vaccines are both 2-dose vaccines, and that's really important. The second dose is what gives you that full immunity. You get some immunity from the first dose, but you don't get to that 95% mark unless you've had your second dose. Depending on whether you're getting your Pfizer vaccine or the Moderna vaccine, with the Pfizer vaccine, it's going to be 3 weeks after the first shot that you get your second shot. With the Moderna, it's a separation of 4 weeks. Try to get that on schedule. That's how they were studied when it went before the CDC, but don't freak out if it's slightly delayed. We don't have any evidence that that's going to materially affect your immunity. Keep in mind that the side effects might be a little worse when you get that second dose, and plan ahead. That's where I was going to stop this, but last night when I was putting this together, some new information came out that I think is really important here, and that's relative to this UK variant. As most people now are aware, there is a new variant of the SARS-CoV-2 virus, which appears to be more infectious and transmissible. And one question for us has been, the original Moderna and Pfizer vaccines were not developed for this variant. And so the question has been, will your immunization protect you against this new variant of the SARS-CoV-2 virus? And last night, some preprint data was published where they did neutralizing assays specifically with folks that had gotten the Pfizer vaccine. That is, folks had been immunized against the SARS-CoV-2 with the Pfizer vaccine, and then what they do is they take the antibodies that those patients have developed and outside of the body, this is a benchtop lab experiment, they expose this new variant virus to those antibodies, and they see if they still attach to that spike protein. And indeed they do, which is reassuring. It's not 100% conclusive that this is going to be protective, but it's certainly very good evidence that it will. So that makes me feel a little bit better about that situation. So this is who I am. I'm J.B. Ketner. I've been a physician here in Seward for almost 24 years now. I encourage you to stay positive, test negative, get the facts, and get the vaccine. That's how we get through this. So thank you very much for listening.